When it comes to back injury and back pain, most doctors will try to exhaust all non-surgical remedies before sending you to a surgeon. Even then, there are 3 things you have to consider carefully before back surgery.
Selecting the right patient, selecting the right doctor, and selecting the right operation. And then, of course, the patient has to work hard on rehab. So it's just not, we do our work in the operating room and then, you come out and you're good to go. So it takes a lot of work on the patient's part. And the fact is that patients can return to their activities with both a fusion and disc replacement.
Yeah, this guy is incredible. Dr. Geyer he's the guy.
He's the guy. He works with the FDA to develop a disc replacement device called anterior lumbar interbody fusion device. And he says there is lots of evidence that disc replacement works to reduce pain and increase mobility. But implants and discs cost more than just basic fusion.
The fact of the matter is, because the insurances give patients a hard time about approving it, that a lot of surgeons don't want to take the fight to the insurance company, and they tell the patient, look, I can't get it approved, the fusion is fine, and they're not committed to the technology. And then the other thing to consider is that, unfortunately, the reality is that surgeons make a lot more money by doing fusion than they do disc replacement. But we are dedicated to this technology. We've been the pioneers, and we've done more than anybody in the country here in the U.S.
It's a pretty gruesome surgery where the team goes through the stomach and around organs to access the spine. But Dr. Geyer says it is worth exploring if you are one of the millions of Americans suffering from debilitating back pain. And really, it does put just such a kink in the way you move through life if you're constantly suffering. I mean, the spinal cord is essential for movement.
Right, absolutely. And especially for, professional athletes,
yes.
If they want to get back in the game. And people who aren't professional athletes haven't been able to done is, retain and rebuild some mobility after back surgery. So just kind of some interesting new technology when it comes to that kind of injury. All right, let's get you outside now. Let's talk to Brian Nobles and check in on traffic.